Hello, my name's Flora Ogilvie. I'm a consultant in public health at NHS Lothian. And in public health, we focus on the whole population's health. So not the health of individuals, but the policies and strategies that we need in place to protect the health of everybody in the Lothians. So health inequalities are one of the biggest areas of our focus within public health. And health inequalities don't just describe differences in people's health. It's a term that's used to describe when differences are unfair and preventable. And so that is really a big focus of everything that we're trying to do in public health, not just on alcohol and drug use, but across all kinds of different health harms to really get at the core causes of those health inequalities, which mostly come back to poverty and inequalities in people's building blocks of health. So the communities they grow up in, the access to resources that they have, and particularly access to things like income and employment. So unfortunately, across Scotland and in Lothian, we know that there is a significant problem with alcohol consumption. In Lothian, we know that 30% of males and 25% of females are consuming alcohol above the level which is considered the low risk level. And it's important that we refer to it as that low risk level because there is no safe level of alcohol consumption. Unfortunately, we know that consuming alcohol at any level is a risk factor for cancer, cardiovascular disease, and liver disease. And these risk factors accumulate over time. So the more that an individual drinks across their life course, the greater the risk. So we know that in many cultures, alcohol has become normalized. It's obviously a legal drug, but sometimes people can use it to alleviate stress. And in areas where there's higher deprivation, there might be a higher number of challenges in people's life, which could lead to them turning to alcohol to help manage some of those challenges. But it's not only those behaviours that might differ between different areas. In Lothian, we also know that unfortunately in more deprived areas, people are more exposed to the sale of alcohol. And we know that prompting people being surrounded by alcohol selling establishments can be one of the things that normalizes and encourages higher levels of consumption. So I think, as I've said, obviously alcohol has an impact on people's physical health, but it has a much broader impact as well. It can start to impact family relationships within the household, people's ability to maintain employment and therefore their wider economic opportunities as well. I think one of the challenges that we have in Scotland is that alcohol has become very normalised. It's seen as a way to celebrate, sometimes even as a part of mourning. And while it is a legal drug and therefore it's difficult for us to aim for a no alcohol society, we have to continue to remind people that there is no safe level to consume alcohol at and that it does have these wider consequences. So we've been really lucky in Scotland that we've had minimum unit pricing introduced, which has been shown to be a highly effective policy. It's reduced the number of individuals who die from alcohol-specific disease, as well as it reducing the number of individuals admitted to hospital associated with alcohol, and has also reduced the population level of consumption. So this is one of the interesting areas, and there has been research to show that actually because some of the drink preferences that young people have had a slightly higher price point to start with, the actual pricing of alcohol might not have had such a big effect on them. But what we do know is the biggest effect that influences young people's consumption of alcohol is actually what they see being consumed by those around them. So with minimum unit pricing decreasing the overall consumption of alcohol in the population, that's a really important signal to send to our young people. And I think also really important to remember that the evaluation has showed that actually those decrease in harms after the pricing was introduced those harms have decreased most in the most deprived areas of the country. I think, again, we have to be careful with the term responsible drinking. Sometimes it's used by the alcohol industry to kind of promote that actually this is something safe that people can engage in. In public health, we prefer to talk about lower risk drinking, just to remind people that all drinking has that risk. At an individual level, sources of information such as NHS Inform have really helpful advice that people could take if they would like to cut down their drinking, as well as obviously advice as well about how to seek additional support if people are finding their drinking is problematic. So one of the other national interventions which has been really helpful is the medication-assisted treatment standards across wider substance use services. So trying to make access to treatment more accessible, but also trying to improve the quality and the experience that people have when they come into treatment. I think one of the challenges is that we don't have a good evidence base about exactly what type of campaigns work more than others. But more importantly, from a public health perspective, we know that we're not going to influence people's behaviour just through a campaign. So it's really important that we have accessible sources of information so people can understand the risks. But actually, the things that we need to change to help people grow up in a healthier way are those environmental factors, reducing poverty, ensuring people have communities in which they can grow up and build good relationships so they've always got that source of advice at any point in their lives. So I think this is about making sure that people have access to that accurate information. And again, NHS Inform is a really good source of that. CRU is another really good source of information, particularly for young people. But I think a lot of it comes down to relationships and the idea, particularly through youth work, of young people building up trusted relationships with others, having good role models, and knowing where to reach out to for help if they do want additional support. So health inequalities are one of the biggest areas of our focus within public health. And health inequalities don't just describe differences in people's health. It's a term that's used to describe when differences are unfair and preventable. And so that is really a big focus of everything that we're trying to do in public health, not just on alcohol and drug use, but across all kinds of different health harms, to really get at the core causes of those health inequalities, which mostly come back to poverty and inequalities in people's building blocks of health. So the communities they grow up in, the access to resources that they have, and particularly access to things like income and employment.